Thank you, Joan. So my name is Perrin Patel. I am the outgoing resident division president for this past year. So Joan asked me to speak a little bit about the resident wellness initiative that we had launched starting last year. As residents, we had personally identified, in our personal lives, why wellness was so important, the fact that we had friends, colleagues that were suffering from burnout, depression, and unfortunately even suicide was it surrounded us. I mean, it was something that we had to acknowledge, and it was something that we took very personally, and so that's how it came about for us. But I do want to say, so on this adventure for this past year where we had signed up about 35 residents, and we were sending out emails about 1 to 2 times a month, and they had included kind of what Dr. Templeton was saying, where there were easy recipes, quick workouts, funny videos, things to kind of lighten the mood, make you feel better, make you realize that this was something that you were in together. So we also had a Facebook page where we were discussing articles on burnout and women physicians dealing with wellness and burnout. The one thing I absolutely recognized was that, as she said, this was not an individual combat. This was something that had to be done from a top-down method. So how many of you here are medical students? Nobody. Any residents? Okay. And then I imagine the rest are faculty and or involved in some sort of graduate medical education. Okay, so unfortunately, what ends up happening, and this happened to me personally, I'm gonna try to make this as quick as possible because I know Joan has a lot going on today. But so, you come into your residency program, and some of us have a mentality where you're there to work, and of course, you're there to work. But you get to a point where you feel like work is the only thing and nothing else really matters. Especially in residency, I'm an OB-GYN, so our hours are really long. And if something happens to one person, you definitely do view people as, well, why is that person suffering and everybody else can handle it? But that's not really the case. I think burnout gets to everybody. It's just how it gets to that person. And I think that's something that people need to look at and maybe kind of introvert or for self-retrospect and think about it in yourself of how is your job and the standards that you're setting for yourself or the people that you work for or work with, how is that impacting your overall wellness? If there was something that you could do differently, what would that be? And then think of it as if you are a teacher or somebody that has power over other people, how do you think that impacts the people that work for you or work under you? Because it's a trickle-down effect. And so if it's not addressed from an overall area, it's not going to have an effect to everybody. And that means that if you can't take care of yourself, how are you supposed to take care of the people you work with, work for, take care of? One of the things we have are these brochures, Annual Resident Wellness brochures. They describe the program. There's information about wellness and burnout, and then they also describe and have a link to the wellness program that we have on the back. So I have a couple here that I'm going to pass out. You can bring them back to your programs. You can have people sign up, and then there are more outside close to, I think it's on the middle table. Thank you so much.
It's on the next slide.